All right. Hi again, everyone, and welcome to the CTSI Translational Teamwork Workshop Series. My name is Marshall Brooks, and I'm the Education Workforce Specialist in the Workforce Development Corps. We're grateful to Dr. Noyes, Director of the Team Science Corps, for developing and leading this workshop series in translational teamwork. This series does offer a CTSI certificate of completion for those who attend all workshops. I previously sent all of you a UB box link. It's in the workshop email. This box link will be used to post supplemental materials should the presenter have any. These workshops will be recorded. Therefore, if you are no longer able to attend a workshop within the series, the recording will be posted in the box folder. Only those who register for this workshop will be able to access this folder, and we ask that you do not send these materials, including the recordings, to people who have not registered. During the workshop, I will post 2 evaluation links in the chat. Please complete them at the end of the workshop. I will also send an email tomorrow reminding you to complete them. The evaluations are completely anonymous and are essential to the further improving this workshop series and our funding source. Today, Dr. Popescu will present the second workshop on leading a successful research team. Dr. Popescu is a professor in the Department of Biochemistry in the Jacobs School of Medicine and Biomedical Sciences. If anyone has any questions, she has stated that you're free to shout out during. If you don't feel comfortable doing that, you can put it in the chat and I will ask it for you. And then she has asked if you feel comfortable to please have your camera on just so she can see everyone's faces. And Dr. Popescu, whenever you're ready. I think you're muted.
I thought I was ready. Thank you, Marshall. Thank you for that. I am delighted to be here. Thank you, Katya and Elizabeth, Marshall. Thank you for the invitation and for organizing this. I'm truly grateful to the CTSI for organizing this particular workshop. To be fair and honest, we are hired for what people call research excellence, translations, papers and grants that we usually got in somebody else's lab. And then once we're hired, swim or sink, improvise. You know, you're left to your own devices, and this is a gap, or I would say a criticism that I have for the traditional model of science training, and it's not adequate anymore because you are only as good as your team. You can't. You only have 2 hands and 1 mind, and projects are just so much bigger than one person. And putting together a successful team takes time and skill. And this is why I'm here for. That's what I'm here for, to encourage you to have that patience that takes to build a successful team, and to share with you things that I've learned from others or others have published that are good practices in building a successful team. So if I were to share my screen, I would first actually ask that you use your phones. Actually, you can use your computer, so you can join by web or by text. And if you use your phone, please use the 22333 to send the following message: G Popescu 121. So you text at 2233 the text G Popescu 121. And then once you're in, and I see people still typing furiously. This is why I want to have your camera on, because I see how far you got. Once you're in, I'm going to ask that you type as many words that describe any identities that you believe are most important in driving your behaviors. Whatever identities, professional, social, personal, and I started with some, and you can add to those. I identify myself as first a mother, and I bring it anywhere I go. I bake, I make cakes, I encourage pride. I'm a woman, you know, I can't get out of that. I'm white, comes with privileges and responsibilities. I'm a professor, I teach. I'm a scientist, I discover. I'm an immigrant, I will never speak English without an accent. And my kids will forever correct my pronunciation. I'm an introvert. So I have dyslexia. Protector, cultural, professor, scientist, driver, introvert, woman, cultural, researcher, social, mother, woman, driver, protector. Anything else? Professional. So it seems to me like that's the biggest. That's probably what the most of us typed, that we bring to work, and probably it's one of our most important identities, to be a professional, to be the role, to speak for the institution and profession that hired us. I see something in the chat. Let me just see if there's, okay, so that's all good. Well, thank you for that. And what I will do now, I will share this one. Share, and I will make this big, and probably I won't be able to see you anymore now. Okay. And we have done that that little exercise so that we all know that we're not going to come to our new role as starting a team, being hired as, let's say we were just hired to as a faculty or a lab director. We're not coming with a blank slate. We do come with a lot of already experiences, skills, and some of them are going to help us in this process. We already know to do a lot of things. We also come with a lot of biases, and limitations, and we should know about those too. So that little exercise was meant to bring us all on the same page with thinking about our own personal whole, with strengths and limitations. Where am I? Where am I now? So I know what I need to do to get where I need to be. And with that, these are some learning objectives, some things that I would like that we talk about today. And I'm not going to go through them. As Marshall said, all the PowerPoints, any other materials are going to be for your use. So we don't need to take notes about that. The first point that I want to do is that you will be wearing many hats. The minute that you're a lab director or a PI on a grant or a project director, you have a triple responsibility. First, to your lab, your business. Without the lab, there are no people. Without the lab, there are no projects. So first to your lab. And that lab requires a lot of you. To develop research projects, to write and win grants, to manage budgets, to publish or perish. To do that, you're going to have to continuously hone your leadership skills. Like, for example, coming here, or to professional societies, or seeking mentors. You already will have a responsibility for every single individual person in your lab. Everyone comes to your lab, to your team with a goal. To do an experiment, to do a project, to get a degree, to get a salary. Everyone has a goal. Do you know what their goal is? And is that aligned with your goal, with what you want to do for the lab? Because let's face it, that these people that you will train, that you will work with, are going to be a big part of your legacy, of what your research program will accomplish, of your reputation. They may become the reviewers on your grants in the future. They may become the dean of your institution. They will go to a different institution and be the harbinger of your research, speak for your research. And for both these big hats that you're wearing, the CTSI offers different courses and trainings and mentorship in developing a research program and so on and so forth. What I'm here to talk with you today is about building a successful team. Well, first of all, what is a research team? And the dictionary says a group of people committed to working together towards a common goal. And in our case, it's going to be a common research goal because we're talking about a research team. And within the team, every single person is going to have one or even more than one role. They're going to have to be a leader or co-leaders. Certainly one of these people is going to be you. That's what we're talking about here, how to put together, develop, and lead a team. There's going to be a manager. Guess what? That's also you. Very often, it's going to be also you. There are going to be team members, people who do things, do experiments, write papers. Surprise, surprise. That's also you. And other people, peers, staff, trainees. And you're going to see right in here and in just enumerating them, you're going to have a different relationship and a different responsibility and different expectations from a peer or from a student or from an administrator or for somebody that's a volunteer or somebody who's employed. So I actually had this case in my lab with one of my students. At some point, she was very frustrated because I was very clear that I have to see her at least 40 hours in the lab. And she said she's never heard of such a thing, that, she works, she's more independent than that. Well, that's fine, but she's also an employee. So she was very frustrated with that. Well, am I a student or an employee? Well, you're both. Let's look at your contract. Let's see, what are the regulations that supervise, that give us the limits, the guardrails within which this relationship happens. And that's going to be different for it's going to be a one-on-one relationship that you have with each of your team members. Why you need a team? Well, hopefully this is by now self-explanatory, but so that you don't believe me, here are some celebrities that pretty much say the same thing. You are only as good as your people. Your success is the success of your team. And I'm sure somebody said it somehow because it's so pertinent and true, is that your team is going to be only as strong as its weakest link. That's where it's going to break. That's where the the bottleneck is going to happen, where your weakest team is, this weakest link is, and that's the one that you're going to have to focus on. That's a good leader. Detecting what that link is, seeing what you need to strengthen it, and bring it back to where the entire team is. So we're getting to the how-to, which is pretty much in the weeds here. So are there any questions so far? I'm looking at your eyes, and I'm still seeing that everyone's okay. And anything in the chat, Marcia? No? Okay.
No, nothing in the chat.
So one thing that it will be important to discuss, if on an earlier slide, we said that the team's going to have a leader and the team's going to have a manager. And that's something that often people get confused about. So I want to take a couple of minutes to discuss the similarities and differences between a leader and a manager, because you're going to pretty much be both. So to build a research team, the goal will be to get a group of strangers to commit to working with you to achieving your research goal. So basically, you develop a project, you probably went to some funding agency, you got a big grant, and now you need hands and minds to perform this research. How do you get these people to work together? And the leadership part of it is the vision. To paint a highly desirable end goal, a clear image that motivates the entire team, especially when the going gets hard. That's the carrot. That's the carrot. That's telling them about the rabbit farm. Wasn't there like a big novel that they were talking about, the rabbit farm? Anybody remembers? Steinbach, right?
I think that was Of Mice and Men.
Of Mice and Men. Thank you. Thank you very much. Let me tell you what's going to happen when we get this project and we're going to sign the science paper. But you know what? Every single person has a different goal, and it's going to be important for you to paint it to their goal. If they came in your lab to make money, you're going to say, hey, listen, if we get this grant, you're going to get the raise. If they came in your lab to get a big job, right? It's like, hey, listen, this is how this project is going to help you publish the paper that's going to get you in the next big lab. In other words, can you authentically, and this is, you're not a salesperson, you're going to be authentic. And how can I help this person achieve their goals while they work on my project? And hopefully, I hope we're all excited about the project that we spent so much time to get funded. Now we have to communicate that enthusiasm, paint the picture for the people to want to come work with us, work hard, more than 40 hours a week. So that's the leader. So how about the manager? Well, the manager is the everyday things that have to happen in the lab. Schedules, who works on one equipment when. The how-to is for the manager. Specifically for me, and probably for most PIs, you're the leader, you're the manager, you're a factotum. It's up to you to get this enterprise working. And if you can delegate some tasks, you're a lucky one. Good for you. It means that you trust your people, that they know what you're doing, you train them well, and so on and so forth. So in other words, leadership describe the desired fruit and set a ladder on the tree. The manager is getting them to climb the ladder, locate the fruit, pick the ripe ones, putting them in the basket carefully, and so on and so forth. I really like this definition by Joe Fuller, who said, management is getting the confused, misguided, unmotivated, and misdirected to accomplish a common goal on a regular, recurring basis. If you can do that, you're successful. I don't need to tell you that tons of ink or type or internet bytes have gone into writing about how to be a good leader, how to be a good manager, what are the traits to being successful. And there are tons and there's very large body of literature. Specifically for me, I think what helped me the most, I distilled here 3 characteristics. One is to be authentic. As Mark Twain said, or Oscar Wilde, be yourself, everyone else is already taken. So it's just so tiring to try to accomplish or to be someone else. To be authentic, you first have to know yourself, and that already takes a lot of work. Strategic clarity, that's about what we already talked about. Once you have a vision, how are you going to accomplish that? And in fairness, participating in this seminar hopefully will help you to accomplish a little bit more of that strategic clarity. Here I am. This is where I want to be. What would be steps in between to get me there? And lastly, emotional intelligence. Know your feelings and the feelings of those around you, and use this understanding to achieve the desired results. People in the business community and in neuroscience as well, I'm a neuroscientist, are agreeing that emotions really set the values or make us pay attention and enact the values that we have authentically, whether we know about it or not. Our emotions are going to tell us about that. And you can use those to know yourself better and also to know the people with whom you work. And I have a couple of examples about that. But before that, I would like to stop here a little bit. So at this point, we talked about the 3 hats that everyone has to have. We decided that we're talking now about how you focus on your team to make it cohesive. We also talked that in order for you to know what kind of team you want, you know where you want to go. You want to know where you are and where you want to go. And for that, I do hope that we have a couple of minutes to do an exercise. And I would want to structure it in the form of think, pair, share. Meaning, let's take a couple of minutes, each of us, to attempt to formulate in our minds answers to a number of these questions. Primarily, what is your personal vision for a successful life? And how are you envisioning that your lab will integrate well with your life? In that first introduction, for me, I already said, being a mother is a big part of my life, of my identity. I'm not going to orphan my kids to develop a lab. So I'm going to have to work in a way to achieve that kind of lab that allows me to also be a good mother, a successful mother. So I'm going to ask that each of you think about that for a couple of minutes. And then Marcel's going to separate us all in groups of 2 or 3 so we can share our thoughts. We can pair first. And Marcel, after you bring everybody back, we can perhaps share some of the thoughts that different people had.
Sure.
And
how long do you want the breakout room for?
A total of 5 minutes.
Okay.
So once again, the homework is describe your personal vision for a successful lab. I want to be this, I want to do that, I want to have that, I want to experience this and that. And how does your lab, your small profit, non-profit business serve into and fit into your life? Maybe you want to find a cure. You want to be famous. You want to be rich. You want to work with smart people. You want to learn every day. You want to boss people around. Who knows? Everybody's different. So I'm so curious to hear your thoughts. So Marshall, if you are can divide us, that would be great. Thank you. So Katya, that was so well said that once we're all together, I'm going to ask that if you would be able to encapsulate that for all of us as an example for the other. Well, if you just say, this is what I want for my life, and I heard that you wanted impact, immediate, visible in your lifetime. And then you also told us how you tailor your team to serve that impact. That's what I heard from you. Did you want to?
I can repeat that.
Thank you.
Tell me when.
Now.
Okay. All right. So so Gabriela asked me for my vision, and what I told her is that as a scientist, I understand the importance of fundamental research, a very detailed and meticulous plan, and multiple trials and error, but it all takes time. And sometimes it's easy to get disillusioned and a little bit cynical because you don't see results of your labor. Your patients get rejected, your grants get rejected. So to me, when I built my research program, it's important to have projects with long-term fundamental goals, but it's also very important to have other projects or other commitments that bear fruit quickly or sooner, that I can see during my lifetime. I can share it with the team and we can celebrate a success. Because without those successes and accomplishments, it's very hard to stay focused and motivated, for me personally, and I know for other people. And so that's sort of my life strategy, to maintain that balance between long-term goals and short-term successes. And then in terms of the team, I find, and I learned that early on, that I cannot critique my own writing and I cannot critique my own ideas. So I need to work with other people to hear their feedback. And so I try to build my teams of the people who are strong enough to provide feedback, but also open enough to receive feedback, because that's how we all can get better. If I wrote a crappy abstract and my team tells me it's a great abstract because I'm their boss, we're not going to be very successful. But if I'm giving feedback to my trainees and they're not taking it, so you do that track changes and they just reject all the track changes and submit their own version, then it's a waste of effort, that we're not utilizing everybody's strengths. So the ability of give and receive feedback, I think, to me, is a fundamental core of a successful teamwork.
Thank you, Katya.
Sure.
It's going to be hard to follow into in that, but I will need a courageous person to step forward and tell us what they discussed, and again, what do you see as your life's purpose, and how does your lab how can your lab serve that? Somebody just jump in.
Well, I'll go.
Thank you, Bob. I appreciate it.
I actually changed the personal mission to professional mission, because personally and professionally, I'm kind of two different people. But from a professional standpoint, to answer, what do we want to be, et cetera, to be a healer or protector, to prevent harm, to have respect for our work, and experience is satisfaction in knowing, we've helped people. And my team is called Team Alice. Our focus is on preventing medication harm. And luckily, we have a lot of the things that you've described already. We have a vision. We actually have a touchstone story of a woman who was fatally harmed by a medication. And our it's when we talk about mission for our team, it's what would have saved Alice. It is something that each team member we do tell the story. We have videos that are actually told by the person's daughter of what happened to her. So it is emotional. So we do get a lot of buy-in from that, and we've had team members kind of come in and out, and I can tell most of them have certainly kind of the emotional buy-in to it, but not everybody. And I was looking ahead in your slides. I know you're going to talk about identifying good people for the team, and in hindsight, it's like, maybe they weren't the best person for the team.
Thank you for that. So you could talk about how not having the perfect match between the team and the vision can slow you down. And a good, when my chair hired me, he was very kind to impart some advice, and that's one thing that he advised: Gabriela, take your time when you hire somebody. And again, I have it in my slides again: hire for integrity and train for skill. And I will always keep that in mind, because the salary for one person for a year is very expensive, and also the damage that in time, in culture, in aggravation that a person that doesn't match the team can do. So I'm going to invite one more person, and then we're going to move on. So is there anyone here who is looking to build their team? Bob, you already have a team in place. You already have some experience. Is there anyone here who's just now looking to develop a team?
I am.
Sharon, thank you so much.
I'm a one-man show right now, so.
Tell me about that.
I was hired to start a research program, and I'm about 2 years into it with a lot of research projects, and to the point where I need to start building a team to help. I can't do it all any longer. So that's where I am. But it's actually, you're making a lot of great points with like hiring for your team, and not, people don't want to be managed. They want to learn different than what I've done in the past. So this is very interesting, different kind of approach to how to build a team.
Do you have a vision for, you already know what the projects are. Do you have a vision? Do you know?
Not until today, when you guys started talking about having a vision of what a successful team is. I do want everybody to be able to learn every day and to grow. I think that's really important.
Wow, you already identify something that's very important. You want learners.
Right.
So even if you're going to look for a technician or a postdoc or a staff member, you're going to look for their eyes. Yeah. Somebody who's curious, who wants to learn something new, who, when you send them to the manual for an equipment, they don't say, well, it's not my job.
Yeah, I don't want that.
Okay, thank you, Sharon.
Sure.
So hopefully this exercise and also the experiences that Katya, Bob, and Sharon shared give you an idea about how to think forward. And even if you already have a team, how can you improve something that you already have? Or maybe you want to change your research focus. How can you adapt your team to serve that? So let me see if I can share again to move on to, okay, and that will be that. Am I sharing my screen now? Not yet?
It says your tasks as leader and manager.
Thank you very much. Thank you. So as a leader, you tell them which tree to bark on. As a manager, you tell them how to climb the ladder, how to time and budget, space, equipment, facilities, so on and so forth. So I hope we establish that. Okay. So let's say you've got a grant and you need new people for this particular grant. How do you prepare? Well, what do you need? Do you need what kind of expertise and independence do you want? Are you going to want a student, a postdoc, a staff technician? What are pluses and minuses for each? Can you afford them? Can you afford to get the best trained, experienced people? Do you have the money for them? Can you afford a student? Do you have the time to train them? What do you need them to do? And what do they already bring to do that job? Also, for me, I'm an electrophysiologist. I can't hire more people than how much equipment I have. They're going to want time on the rig. They're going to want equipment to use to get data with. I can't afford, it's not responsible to hire more people than I have equipment to provide for their success. And also what is available, how long it will take to recruit, and so on and so forth. So that's your preparation. So once you know these things, you know where you want to be, you know how much money you have, you know how much time you have, you know how much equipment you have. What does this person need to do? Well, I need somebody to open the lab every morning and to close the lab every morning because I have a lot of things to do and somebody has to be there to get packages. Well, for this job, I don't really need somebody who's has a PhD, right? And maybe that person can do other things. Or maybe I only want that person for 50%. What else do I need? Sharon, you already said, you're very clear that you have more on your hands than you can do. What off your plate are you willing and able to delegate? To whom would you trust to delegate that to? What would that person need to know? Is that person going to be like that? No, that's you. We always want to try, well, not you, Katya, you're wise, but most of us want to hire, or at least when we come out of postdoc, we all want to hire a mini me. I can do it. Why can't they? And that's not, it's not possible, and it's not conducive to a good team. You want somebody that has different ideas, different strengths, and different limitations. I put up here a couple of job postings examples. I would say that my students, once they go to start their own lab, that's the one thing that they ask for me. Gabriela, do you have a animal protocol? And do you have a job posting? So here are for your use. That's something that I used at some point, and I wanted a research scientist. I didn't necessarily need a postdoc. A postdoc's going to want to come, train for 3-4 years, and leave. I wanted a permanent person. I wanted a professional that wants to retire from my lab. So I said the research scientist position. And then this is something that I had from somebody else at the Vanderbilt University, and this person really wanted a postdoc. And this is how you apply. This is what I need to have from you. And you will see that in both applications, we asked for more than just CV and some references. You want a CV, you want to see what they've done. You want some references. You want to know that you're not getting something that somebody else doesn't want to use anymore, the leftovers from somebody else. And you want a piece of cover letter or that's written by that person to get to see how they're thinking. How do they express themselves? What makes them tick? Are they very formal or very playful? Are they very, you can learn a lot from a piece of a freely written letter of intent or interests. And this is a posting for the research technician, and these are all a little bit more formal in that the university has their own job application site that you have to go through. You have to have approval to hire. You have to give a range. You have to give a position title, minimum qualifications, and so forth. So you will be better served to work with a person from the research, from the personnel that are trained to do that, to advise you on how to get started on hiring somebody. So let's say now you have 10, 20, maybe 100. We've done faculty searches where we had 200 applicants for a position, and you sift through all of them and you look for education, training, skills, papers, and grants. That's what we look for. But you're also looking for attitudes, values, and behaviors, because Katya, you want somebody strong and sure, and you want somebody who's gonna do the things that you need them to do. And Bob, you want somebody who's caring and cares about people. So there you're gonna be looking for these soft skill, people call them, but I think those are the strong skills, right? Training people can have. It's the integrity that's below that how do you train for that? Always do your due diligence. Always talk with a previous person that worked with someone that you want to hire. You may meet with them, have a fabulous impression. They look great on paper. Do talk to a couple of people that worked with them. You never know. And the most important thing for me, does the overall package match with your gut feeling? Does it match? They say they're outgoing, but they don't want to talk. They say they're strong, but they're, so how does that match of what's on paper with what you're seeing? What does your gut feeling tell you about that? Use your emotional intelligence. And once you kind of made up the person, the vibes are there, become discussing, what do they want from you? Can you offer them? Are you okay with that? I had people who were, I would like to do this research with you, but I also have this separate course that I would like to take. And maybe that course makes them a better team member for me. Sure, let me pay for half of it, or no. And I'm like, I had said that too, where, there's going to be a student, Gabriela, I need to support myself. I need to work over the weekends as I don't know what. I'm like, no, come work here. I'm going to give you a little bit more salary or stipend, and you work Saturday and Sundays here. Think about the project rather than, or I had another student who said, Gabriela, I really need to, refresh my brain. I'm going to work on, I can't be in the lab on Saturdays, which is, by the way, okay, but she had to say that. I'm going to be a docent at the zoo. I love animals, and I find that makes me happy. How wonderful. Let's have a lab meeting at the zoo one day as a team. So work and see what's acceptable to you, because that's something that they need for their either professional development, life goals, or mental health, which is very important. Write and sign an offer letter. Always work with a personnel officer at your institution. They're going to tell you to stay out of trouble with the law. we don't want to break the law. And always hire for integrity. You can train for skill. That's just my motto. I could have it written down on my wall. That's just the most important thing. And a couple of, I think, examples I have, or dear successful candidate, always form a letter, tell them that they're going to have to work 100% or 50% or 25%. Are there any benefits associated with that? Some people work for the health insurance. If that's true, they have to work half-time. Can you accommodate that? At least half-time. If you go 40%, that's not covered. So different people need different things. Make sure you know what works for them. Make sure that it's in your interest, that vision, that this person works for you and you accommodate them. Appointment begins no later than this date. You know, a lot of times you're going to hire international people and then the visa drags on forever and your grant needs to be renewed and the employee is not here yet to do the experiment. So there are things that keep in mind. That this is my favorite. You advertised, you hired, and now they came to work. It's like, tell me what to do. So probably this is, I would say, the most important slide that I would encourage all of you to think through and keep in mind that team building is a process. And I've had my lab for maybe 15, 16 years now. The type of lab that I'm running in a medical school where we have students that come and go, teams are very dynamic. Students graduate all the time, new trainees come in. So it's a challenge for me to keep the culture, which is very important for me, and to keep the skill or the expertise. I don't record anymore. I don't pipette anymore, unfortunately. Somebody else has to be there to impart that hands-on training. So that's on my mind all the time. If this more senior person leaves, somebody else, always think of succession planning and make sure that how you continuously keep the expertise. What this slides actually tells us about is about the relatively stereotypical phases through which teams or members in a team go. Let's say you just start a new team, Sharon, and you're going to hire 3 or 4 people. They're going to all be at the same level. And you're pretty much going to know that they're all positive and polite and want to fit in. They just got the job. They're excited, everything you say. And even if you have an older, more senior team, and then you bring in a new person, very likely this person will very much conform to begin with. They're excited, they just got the job. They project all their most beautiful dreams that is going to happen in this job. They're going to lose 20 pounds and they're going to make $1,100, and everything that they want to do is going to happen in this job. And then, Monday morning after a couple of weeks comes up and conflicts arise. I wanted to take Monday off and I couldn't. And I came in over the weekend and somebody didn't close the refrigerator. And I'm frustrated because I was planning on Tuesday to do this and this experiment and the mice didn't come in. And life happens. How do you deal with that? So once the storming happens, you can expect some rough times, especially if a number of people were hired at the same time, and that bonding where the culture is not there to imprint itself on this new team member. hopefully, once you offer guidance, meaning some feedback, this is what we do in this team, this is what we don't do in this team. Please tell me, why should we do this in this team? Why should we work this way? It's a good idea, however. So there's going to be some conversation, some guidance, and hopefully you're going to move toward more agreement, consensus. People understand what the norms are in this lab. We don't do this in this lab. We celebrate birthdays in this lab. We eat cake when Gabriela brings it in. You know, there's some culture going on here. And people understand that, hey, you know, in the beginning when they were just learning, a lot of work was going on behind the scenes to train them. And they know that because now they have to do it for somebody else. They learn a new appreciation for the people who train them and for their mentor, where they just wanted papers and the mentor was so bad, but now they think, oh my God, he had to do that or she had to do that, a new appreciation. I think Mark Twain said something like that. What did he say? He said, when I was 12 or 14, my old man was so like stupid. I was just so embarrassed with him and everything. By the time I got to be 20, it's amazing how much he learned. So I find that all the time that, you know, once you see what's behind the scenes, you get new appreciation for your team members, and hopefully you get that norming. And then that's where you want to stay, norming and performing and norming and performing. And I will say that at this point, knock on wood, that's where my team is. I have a good team of maybe 4 or 5 people who have been with me for a long time. And they are the ones that maintain the culture, and they are the ones that train the new people that come in. And they say, hey, listen, this has worked for us. If you have a better idea, tell us how to do it differently. Otherwise, we're just going to eat the cakes that Gabriela makes. And that's the norming in our lab. Sometimes sad, sometimes happy, sometimes bittersweet. Some people have to move on. People retire, get a new job, change to new different things. All good things have to come to an end, and as do either the entire team. Maybe you took a new job and you closed this down, or just one member or a couple of members graduate. That happens in academia all the time. Adorning, celebrate, acknowledge, mark the event, allow some personal satisfaction for all the work that has already been put in, and hopefully some bonds have formed so that, hey, this past team is my new network and they're going to be there forever. I always say, once in Pop Lab, always in Pop Lab. It's just like you can't get out of it. Yeah, you're going to always be part of our network. And the same thing, you know, in member behaviors, but also what do you have to do at this time? So this is about how people usually behave in each of these stages, and of course there's some back and forth. But also, what do you have? What is your role for a newbie? Okay. So onboarding. And I have that. I have a manual of onboarding. You know, this is what we do for you. This is what you do for us. This is how you open this equipment. This is how you turn it off. It's a manual. This is how we name our files. This is what you keep them. You keep them in 2, one on the cloud, one in the refrigerator. Data is what we're working for. This is how we manage data in this lab. And a number of other things. Many people and many organizations now advise that if you have trainees, to actually write it down and discuss it over with them. My IDP or a compact with a postdoc. Have any of you worked with IDPs, individual development plans? I still get an email every now and then, Gabriela, you said you want to work on your communication. It's like, okay, delete. I don't have time for this right now. But it with a trainee, it's your job to say, hey, listen, you know, these are things that we said we're going to do. We said you're going to go to 2 meetings. You're going to publish a paper. I understand the pandemic was that. Let's reevaluate. Or, oh, you did better, even more fantastic. With the storming, it's the build trust. I mean, I can't say enough about trust, especially in science. How can you sleep at night if you don't trust the work that the team members work on, which you will put your name and you'll sign off on, if you don't trust your team members? And how do you build trust? And again, there's been a lot written on this. And for me, transparency and accountability. You know, I always say, this is what I do. This is okay. This is the statistics that I use. If maybe they're not the best, let's try another approach. I really trust this experiment because this and this and this. If you don't buy it, let's try it again. So you do agreement, checking each other's data. And it's also a gut feeling, emotional intelligence. Do they say what did they do what they said they're going to do, and so on and so forth. So communication, talk to them. Maybe they don't know, you know. So conflicts, it's your job. The culture in your lab, the way that people interact in your lab, it's your job. Positive but firm, positive and firm. Dear student, this is really, we tried this, this is not working for you. It's been 6 months, there's like 2 data points. It's going to take 20 years for you to get this PhD. Let's get you into a different lab. Firm. Norming, different people do different things. Team building, it depends on what kind of people you have in the lab. You know, if they're young and want to go to a football game, I don't know the rules. I let them take me and explain the game to me. Or maybe we want to cook together, or just something where people can be relaxed, bring their families, and pets do wonders, and get to know a different side of them, and allow them to bring their whole person to work. Performing, this is where, Sharon, you want to delegate, and that's what are you going to delegate? Things that you're not excited about, things that you maybe don't do as well, and somebody else can do better. And again, there's tomes on delegating, on how to do that successfully. And adjourning, you know, celebrate, take time to celebrate achievements. If, you know, maybe you're going to work with these people again, maybe they're going to become your dean, who knows? Try to stay positive, and here's a resource, your future network. About leadership styles, this comes to knowing yourself. Which one are you more naturally? Do you do what I tell you? I only need you to go get these packages for me at 5 p.m. Okay, that's what you do this. Or come with me, let me show you how to do this. So I love plating cells. So sorry, I can't do it anymore. I don't have enough time. This is how I do it. Come, let me show you. People come first. That's a democratic or the democratic one. What do you think? Well, that's a good one, but it might take forever. So maybe doesn't work for you. Pace setting. 100 miles an hour. I can do it. You should do it. Coaching, you know, try this way. Did you try that way? So different styles that work for different people. The literature converges on authoritative and coaching as being perhaps most effective, but you have to, it depends also on the team. Are these junior people? Are these more senior people? Are these more experienced people? The style that you're gonna, but definitely don't be these people. Now that I made noise and dumped on everyone, I'm off again. Did you have one of those ever? I had one of these. I prefer Times New Roman. It's like, okay. And the comma here. Or never there. Don't be this person, never be. No. This is sometimes me. I made cupcakes to go through your review. So here, I'll feed you. So I have to watch for this one. Do you know any of these people? You do? Okay, I'm not gonna ask names. Okay, and I would be remiss not to tell you that, you know, we are in a creative field, and leading creative people is a job in itself. That's why you're hiring them, for their idea, for creativity, doing things better, faster. And they're independent minded. They wouldn't be creative if they weren't. And they're like, don't tell me what to do. It's like, good, but so you know, some are very creative but not productive, and it's for you to keep everything in budget and on schedule. You're the man, not only the visionary but the manager also. And there are manuals on how to kill creativity, right? And one of it is this one. Yeah, but it's never done before, so I'm not going to do it. Others say that, hey, you just nurture, allow independence, inspire them, exert flexible authority. Okay, you can't do it this week. However, we're going to do double next. We're going to do 2 experiments next week. Or, okay, you can't do Western blotting. I understand. Okay, let's do it this. You can do it this way, and work with somebody else that can do something else. I think this is the most important and probably the most effective. Make them feel they are working for themselves. Show how their goal and the lab's goals are the same. And, you know, whether there's somebody in their family that they feel that they can help with the research that your lab is doing, the drugs that you're developing, the new diagnostic procedures, or this is going to get them their new job that they're looking for. This is going to get them the promotion that they're looking for. But here again, you have to know the people. You have to know what they want. They want to get into med school. Okay, that's going to be on the MCAT. Do it. Let's do it. It depends on what they want. And again, it can't be enough said about mutual respect, communication, trust, and the skill that one gets in participating in workshops like this. I don't know if you're aware, but we as UB employees have access to that Skillsoft training. They're online, free, on anything. How to use Microsoft Word, or how to lead, how to become more empathic, and how to become more skilled in this and that. I'm not sure if you're aware of that. I'm glad to I would send that link to you, Marshall, to share. But how to win friends and influence people, right? Patience. I can't say enough about patience. Teams take time. People take time, patience, flexibility, tolerance. Having said all that, we all need to live within laws, regulations, policies, and so on and so forth. educate yourself, talk to the personnel person at your institution. Don't make mistakes that get you in trouble with the law or with the university policies or anything like that. Because you are all these. And each role implies responsibilities and obligations, both for you and for the team member. And for example, some of my team members are required to fill in weekly timesheets. Otherwise, I get a call and it takes 20 minutes of my time because somebody didn't fill in a timesheet. And I'm a researcher. I want to do research. Make sure that they understand that that's something that they have to do for everything to work fine. Reports, they have to be on time, whatever. For me to keep my NIH funding, every year I have to submit a progress report and the names of all the employees and this and this and this and that, right? If I want to keep the grant, I don't have to do it. Only my dentist told me, you don't have to brush all the teeth, only the ones that you want to keep. So I keep saying that to my students too. You don't have to fill out this sheet, only if you want to keep your job, half in joke, but it's true. So, it's part of our jobs to learn about the legislation, the policies pertaining to hiring and firing, non-discrimination, conflict of interest, check all the boxes. It's for a good cause. Takes time, it's for a good cause. The box stops with you. You didn't know you signed up for that, did you? I never fire people. Instead, I help them find a new position that better matches their interests, skills, and talents. I just love this one. So how about starting a team in the pandemic, Sharon? Aren't you lucky? Training people with a mask on from 6 feet distance and so on and so forth. Yet the show must go on. Life doesn't stop. We're happy and blessed and fortunate and privileged that I feel that way, that I can still do my show. Safety first. We learned the hard way that the lab may be shut down at any time. And I knew this as a student, as a graduate student, that, you work with the cells when they're ready to be worked on, not when you have time. The same with the lab. Work while you can work, because you don't know if you can work next week. They're going to tell you to be home. They're closed at schools. You're going to have to stay home with your child. Do it now. Be flexible. Hey, you thought you're going to publish 2 papers this year. Hey, knock on wood, all my people are safe. I don't have any burnout. I don't have any depression. I don't have any mental health. That's success for me. I'll take you guys out for dinner. I have a strong vision. I can be flexible. If that's not happening this year, I'm going to have to live a year longer to make it happen. I say that with my husband all the time. I have to live longer. So, yeah, that's what I learned in the pandemic, that I'm not only the leader and the manager and the team member, but I'm also the counselor in chief, the hand holder, it's okay. It's okay. It's okay. Okay, we're going to get through that. Burnout has been a big, I'm not sure if you're aware, but I'm very active with the AAMC. This is the American Association of Medical Colleges. It's basically the association of all medical schools in America. And they look very much at student well-being and faculty well-being and resident and medical profession well-being. And burnout has been an issue, together with harassment and discrimination, the Me Too movement that we all know about, the Black Lives Matter that has really shaken society, and our labs. And science is a social activity, and our labs live in society, and they're subject to politics, and it's something that personally I take to heart, and safety first, health first. My research program works to make life better. I would hate it if my research program makes anybody's life worse, including my students and my team for sure. But first, the oxygen mask principle. You must take care of yourself before you can do anything for anyone else. Manage your stress, get support from peers and mentors. Go to the zoo, whatever works for you. Cultivate patience, meditation, yoga, whatever works for you. Be alert to your own well-being, and model it and encourage it and support it in your team. So that's all she had for today. And let's recall that you have at least the triple responsibility to your business, to every person in your business, and to making the people in your business a team. Teams are groups of diverse people with a common goal. It is up to you to communicate that goal and show people how that works for them. You're the everything, the leader who sets the vision and the strategy, and the manager who sets the organization and the execution. And developing a team takes time, patience, skill, and practice. Like today, you hopefully you can take some resources and do some extra readings for things that maybe you haven't thought before. There's a lot of literature on this, and I will send to Katya the links to Skillsoft that are free for UV employees. And now there's just so much more online that support that you can gain for that. Mission-based job description. I cannot stress enough how important this is, just to tell every single person what they do, no matter how menial, how stereotypical, helps the job. And the example that I heard from somebody is how proud this cleaning person was in working in a hospital, that it was their job to keep this place clean and free of germs, so people can trust that they're not going to get sick. Hire for integrity, train for skill. That's again. Mindful and deliberate about culture and climate. Be on the alert. What's the dynamics? Are they not getting along? Is one person spoiling everybody else? Is one person who's pushing ahead, pulling ahead, and hey, can we all get with that person? Educate yourself. We're all learners. I don't need to tell you. Obviously, you are here to learn, to hear different things. Recognize that hiring and firing practices are regulated by laws and policies, and you can get into more trouble than it's worth by saving the time, thinking that you can save the time not to abide and to make yourself aware of them and to abide. Locate resources related to managing and leading personnel in academic medicine, and apply the lessons from a pandemic. What will change, what will stay the same, and there's always change. It's just this pandemic seems like nothing stayed the same. So, and also I'm leaving you with just some self-reflections, things that you can, you would be useful to think ahead. How many people, at what career stage? What would you want from them? And then name your core values. Are you going to be a team of professionals or a team of rivals? Some people work like that. I'm not going to give names, but yeah, they're going to have 2 postdocs on the same project. And it's like, okay, who gets there first? It's not me. It works for other people. It's not me. Excellence and impact. We all want that. Personally, I use a bullet journal. I don't know if you know what that is. Google it. It's really a notebook. And I have a bazillions of them. And, you know, it's my schedule. It's my quotes from people. It's my to-do. It's my everything. And many other resources you can use. Productivity tools, you can use all kinds of things. So I think that's all that she had. But I will, I'm not sharing anymore, right? I will make a list of resources and mission-based job descriptions. I think that's just fabulous. Any other questions or anything that I can offer as a result of things we discussed, or maybe you can think of things that happened to you that you have an issue to discuss, or something that stuck with you. Well, it's 5:32 and I've already taken 2 more minutes than I should have. I'm big proponent of staying on time. And thank you so much for the opportunity. It's really been my pleasure, and looks like I just expanded my network. Follow me on Twitter at Popstar Lab.
Thank you very much, Dr. Popescu.
Thank you so
My
much.
pleasure.
We'll
My
see you guys
pleasure.
next week. Bye.